I'm Joe Ferry, and I am a chaplain with Open Arms Hospice. I primarily visit and give support both emotionally and spiritually and relationally to patients and families in our in-home program. So I'm home to home. Also do on-call visits to the hospice house when we are needed, so get a good overall view of what's going on. We take a team approach to what we do. We have bi-weekly interdisciplinary group meetings where we, at least every 2 weeks, discuss each patient, their medical, social, and spiritual situation, and we keep each other abreast of what's going on with the patient as a whole person rather than just one glimpse of one aspect of that person. Very early on during the admission process, which occurs within 5 days of admission, the chaplain makes an initial visit and assessment, a spiritual assessment, as well as a bereavement assessment that is focused primarily on the patient's own grief work that they're experiencing, but also involving the family, where we try to identify the person's needs as well as their resources for support during that time. And our spiritual assessment is a more general assessment where we try to find out their spiritual roots, so to speak. In this part of the world especially, we have predominantly church-centered folks, but we also minister to and serve folks of all sorts of spiritual perspectives. We don't try to impose or change anyone's spiritual approach. We try to come from where they're coming from and help connect them with the resources they have, maybe strengthen those connections or establish some new ones, or sometimes we actually serve as more or less their spiritual home, so to speak, away from home. And we start early in the process, stay with them. Also, we follow the families with our bereavement ministry officially for 13 months after the patient dies. But sometimes we go a little beyond that when the family members want that and need that. We try to serve as a catalyst for the patients and families to dip into their own spiritual strengths and resources. We contact faith communities sometimes if the patient or family wants us to do that, to make sure that they're aware of the person's being under hospice care or even in the grief process. And we come not from a perspective we're trying to impose, but we try to encourage the patient to reflect on their situation through the lens of their own spiritual background. Sometimes we find that there are some unhealthy beliefs about death, or for example, that somebody might have the unhealthy view that death is something that's a punishment for something or something like that, and or they may have the view that when someone dies, since they're a person of faith, they should be happy, and there is an element of joy to know that that person is at peace and that sort of thing, but there's also the element of just the pain of losing something or someone so precious. And so we try to help people know that it's okay to cry, it's okay not to be on an up level all the time. I tell people, for instance, when I die, I want somebody to cry. I want them to know, for somebody to act like to lose me is a significant loss. And so we try to encourage people to go to their grief and to their anxieties and stuff so they can go through it rather than spending all their energy trying to avoid it.